Therefore, as we previously saw, it is totally recognized that the first relational experiences play an important role in the course of a child's development. Children researchers have been interested in studying the processes through which this happens, this ability they have, and this impact that the first relational experiences have in the course of the life of a human being. Flavell and Miller analyze the cognitive substrate that enables human social development. This development implies that the child must discriminate from others and at the same time gradually acquire a very strong and solid sense about the self-concept, about the I concept, an I that is independent and different from the others, and at the same time has the skills to connect socially and emotionally with other people. Social cognitive development, therefore, begins with the first moments of separation and individualization and of emotional connection that the baby has with the others. This development includes the increasing understanding of the emotions and the perceptions, and also the children's knowledge about personal attributes and of others too. It also includes the knowledge about the causes of behavior and an understanding of social relationships that involve the recognition of reciprocal relationships, for example, friendship, love relationships, and moral judgments too. What is self? Self is a concept that indicates the I of the mind. A central task for the child is to acquire the notion that he is a distinct and separate entity, clearly differentiated from all others, but emotionally and socially connected to them. The process of articulation and definition of self begins early in the life of the baby. In the same way that babies learn very early that human beings are special objects with which they can interact, from which they receive love and care, they begin to distinguish them from other objects or things. The baby gradually learns that people, and not objects or things, respond to their signals. They learn that the behavior of other people can be predictable but also unexpected with respect to their own behavior. They learn that contingencies go in the opposite direction, that people act, and that the baby reacts accordingly, which enables them to expand their awareness of reciprocal contingencies. Reciprocal interactions, therefore, are those which enable the process of self-differentiation, that is, the relationships that have feedback. Reciprocal interactions are relationships that go back and forth. For example, the child cries, and there is an adult who is able to calm him and who is able to understand why he cries and meets his needs. As well as this, the first attempts of a baby to communicate are very important, because they are the first attempts to connect with other people. In the first moments of life, when the baby begins to give signs of communication, he uses everything he has to be able to do it: gestures, crying, facial expressions, emotions. Babies learn to use a whole repertoire of expressions as a guide for their actions. At the end of the first year of life, babies will have a minimum of awareness of the existence of internal experiences like desires, emotions, and intentions, and that these internal states can be shared by other people, because the first thing that happens with a baby is that what he feels are perceptive sensations of well-being or of discomfort, but they still don't have a name. The baby doesn't cry knowing that he's hungry. What appears is a bodily sensation of displeasure, but there is a mother that encodes this crying, understanding that at this moment the baby is hungry. These authors, Miller and Flavell, say that the peaking point of the connections with others is what they call social attachment, and it is based on the description of another psychologist who has worked in the field of children's psychology called Bowlby. Bowlby worked and developed a theory called theory of attachment, which says that attachment results from the development of bonds that are loaded with affection with some people, like the mother or the father. It is a two-way process of social interaction, to the extent that it always involves the feelings and behavior of both parents and baby. Around 9 months of life, babies begin to show clear signs of specific attachment formations, so around that age, babies begin to choose whom or whom not they want to go with.